Welcome to Medical Licentiate Emerson Channel. Nasal polyps are a common condition encountered in medical practice. It's crucial for medical students and practitioners to have a strong understanding of nasal polyps. This understanding will allow for accurate diagnosis and effective management of patients. This essay will provide a comprehensive overview of nasal polyps, covering their definition, causes, symptoms, diagnosis, and treatment options. Nasal polyps are soft, non-cancerous growths on the lining of the nasal passages or sinuses. They result from chronic inflammation and are associated with conditions like allergies and asthma. As medical professionals, it's our responsibility to provide optimal care for patients suffering from this condition. This involves a thorough understanding of their presentation, diagnosis, and treatment. Nasal polyps, simply put, are teardrop-shaped growths. They occur on the mucous membrane lining the nasal cavity and sinuses. Imagine small grape-like sacs protruding into the nasal passages. They are the result of prolonged inflammation in these areas. The exact cause of this inflammation is often unclear. However, we know that chronic sinusitis, allergies, and asthma are major contributing factors. Picture the nasal lining constantly irritated and inflamed. This leads to fluid buildup and the formation of these polyps. Understanding this process is key to effectively diagnosing and treating nasal polyps. Nasal polyps can be categorized into different types. Two common ones are antrochoanal and ethmoidal polyps. Antrochoanal polyps typically originate in the maxillary sinus, located in the cheekbone area. These polyps often grow quite large and can extend into the back of the nasal cavity. In contrast, ethmoidal polyps arise from the ethmoid sinuses, found between the eyes. They are usually smaller and multiple in number. Understanding these distinctions helps in determining the extent of the condition and guiding treatment strategies. Nasal polyps manifest in various ways, impacting patients' quality of life. A common symptom is nasal obstruction, a feeling of stuffiness or blockage in the nose. Patients often complain of difficulty breathing through their nose, especially on both sides. Another telltale sign is a runny nose with clear mucus discharge. Patients may also experience a reduced sense of smell, known as hyposmia, or even a complete loss of smell called anosmia. Some individuals may also present with facial pain or pressure, headaches, and a diminished sense of taste. It's essential to listen carefully to patients' descriptions of their symptoms to guide the diagnostic process. Section 5. Unmasking the culprit diagnosis of nasal polyps. Diagnosing nasal polyps involves a combination of patient history, physical examination, and specialized tests. During the physical exam, we visually inspect the nasal passages using a nasal speculum. This allows us to see any visible polyps or abnormalities. Nasal endoscopy, a minimally invasive procedure using a thin, flexible tube with a camera, provides a detailed view of the nasal cavity and sinuses. This helps visualize the polyps, assess their size and location, and identify any other underlying conditions. Allergy testing may be recommended to determine if allergies contribute to polyp formation. This involves skin prick tests or blood tests to identify specific allergens triggering the patient's immune response. Section 6. Navigating treatment options, managing nasal polyps. The management of nasal polyps aims to reduce inflammation, shrink the polyps, and alleviate symptoms. Treatment typically involves a combination of medication and, in some cases, surgery. Corticosteroid nasal sprays are often the first line of treatment. They work by reducing inflammation in the nasal passages, effectively shrinking the polyps. Oral or injectable corticosteroids may be prescribed for larger polyps or more severe cases. If medications alone don't provide sufficient relief, surgical removal of the polyps may be necessary. Endoscopic sinus surgery, a minimally invasive procedure, is commonly performed. It involves inserting an endoscope and instruments through the nostrils to remove the polyps and improve sinus drainage. Section 7. Complications and long-term outlook, prognosis, and potential issues. While nasal polyps themselves are not life-threatening, if left untreated, they can lead to complications. One potential issue is chronic sinusitis, as polyps can obstruct sinus drainage and create an environment conducive to bacterial growth. This can result in recurrent sinus infections, facial pain, and headaches. Another concern is the development of sleep apnea, a sleep disorder characterized by pauses in breathing during sleep. Large polyps can obstruct the airway, particularly during sleep, leading to sleep apnea symptoms such as snoring, gasping for air, and daytime sleepiness. Section 8. Conclusion. The importance of comprehensive nasal polyp management. In conclusion, nasal polyps are a prevalent condition that requires a multifaceted approach to management. Understanding the pathophysiology, clinical presentation, diagnostic methods, and treatment options is crucial for medical professionals to provide effective care for their patients. Early diagnosis and appropriate treatment are essential to alleviate symptoms, prevent complications, and improve the patient's quality of life. Continuous management, including lifestyle modifications and long-term medication, is often necessary to control symptoms and minimize the risk of recurrence. By staying informed about the latest advancements in nasal polyp management, healthcare providers can ensure the best possible outcomes for their patients. Thank you for watching Medical Licentiate Emerson Channel.